Hey everyone, it's Dr. Erica Person and welcome to a new episode of the Flex Audiology Show. Today we are going to talk about something that affects millions of people. It is tinnitus. So before we get started, I just want to clear up one thing. It is pronounced tinnitus. It is not pronounced tinnitus. Tinnitus gets confused a lot with tendinitis. So we're going to start there. But before we do get started, if you can do me a favor and hit that subscribe button, that really helps us grow our reach and I appreciate it so much. So the first thing we're going to talk about, tinnitus is a symptom. It is not a condition. Tinnitus isn't a disease. It is always a symptom of something, and it's your body's way of saying, hey, something's going on. We better stop and figure out what it is. Now that something, it could be related to hearing loss, noise exposure, medications, jaw alignment, even stress. So when someone tells you, if you're in a medical office and someone tells you, everybody has it, you just have to learn to live with it, that is absolutely not true, and it's not very helpful. So if you are a physician or you're an allied healthcare professional and you're listening to this, it is not helpful to tell your patients that there's nothing that they can do and then if they have to live with it. The key is for us to figure out what is causing the tinnitus, why it's happening, and get a thorough tinnitus evaluation by an audiologist who specializes in tinnitus care. So what happens if it is permanent? What if we find out it's not something that can be medically treatable? Well, then we're going to focus on management. And so let's go back and say, okay, is it a medical cause? Could it be an ear infection? Could it be wax impaction? Could it be a medication side effect, too many supplements, coffee, just general blood pressure, cardiovascular disease? So if we find that it's something medical, we want to treat that medical, and 9 out of 10 times the tinnitus goes away. So that is a happy ending for everyone. So if we find out that the tinnitus is permanent, maybe it's due to noise damage over the years and you're just out of options, that's where the management strategies come in. When we talk of management and treatment of tinnitus, the goal is not to get the sound to go away. So for some people, what happens is that it does diminish so significantly that they feel like it goes away, and that is great. For others, our goal is to make the sound become non-invasive, and so it fades into the background. And so if my patient reaches the point in the therapy where they say, I only notice the tinnitus when I think about it, or maybe it only spikes once or twice a day, that is a win as far as I'm concerned. So when we look at your tinnitus, we're going to look at you as a whole person, not just your ears, because it's really not an ear issue, okay? And that is so important for us to understand. So we want to look at your sleep, your stress levels, exercise, your diet, your cardiovascular health, all of that plays a role. So for example, like I know if I don't get very good sleep, or maybe I'm even simply dehydrated, my tinnitus will peak. If I have high anxiety, that is along the same spectrum that houses the tinnitus, and so that can make it louder as well. So we really want to look at your lifestyle and look at your body really as a whole. And a third key that I really want to stress is that not every hearing care office specializes in tinnitus. A lot of them have it on their website, and what they are hoping is that you have a permanent hearing loss, that if you are treated with your hearing loss, a side effect is that the tinnitus goes away. And that is actually super, super common. So we do get a lot of patients that the number one reason they have tinnitus is they simply have hearing loss. Once they are treated with hearing aids, the tinnitus kind of goes away or fades away into the background. And so a general audiology office or a general hearing aid specialist office, they're going to focus primarily on the hearing aid portion of it, and other sound therapy options, they're not going to really be able to get into just because they're not trained on it and they're maybe not even aware of what products that are out there. So tinnitus care on itself and the evaluation, it requires a lot of individualized testing and management planning, and it's not a one-size-fits-all approach. So if you're asking for help or you're looking for help, really dive into their website and make sure they specialize in the evaluation and treatment, and it's not just discussing hearing aids, okay? So let's talk about what doesn't work. Over-the-counter supplements. These are miracle cures that you have seen all over the internet. As soon as you start searching for tinnitus, they will start popping up in all of your social media feeds. They'll pop up on your Google searches, your AI searches. Save your money. There is no scientific evidence that any of these works, and most of the people that have tried them will report back to me and say, it didn't work. I'm now in your office looking for some additional help. So that's who I see. I see the people that it doesn't work for. I see some of the blogs online about who it doesn't work for. The internet is just full of misinformation in this space and the quick fixes. Tinnitus evaluation, management, and treatment, it's not a quick fix, okay? This is going to be something that we want to use evidence-based strategies. We're going to look at sound therapy, counseling, cognitive behavioral approaches, and of course, if you do have hearing loss, we can look at that as well, okay? So here is my big takeaway. Tinnitus is not something that you have to live with. It's a signal, it's a symptom, it's your body's warning system. And through right evaluation and management, we can really start to pinpoint what's causing it and move it from really a place of where it's impacting your life to a place where it's not impacting your life. So if you are struggling with tinnitus, ringing, hissing, buzzing, be any sound that you're hearing in your ears, reach out to an audiologist that specializes in this area. And then our goal is to get that tinnitus back to where it's not overwhelming your life. And maybe you could get a little bit of quiet time in your world. So thank you for watching. And as always, take care of those ears. Reach out to me if you have any questions, comments, or concerns. Have a great day.